I'm a pediatric infectious disease specialist by training. I have practiced pediatric infectious diseases for more than 35 years. I've worked all over the world. I have studied pandemics and worked with epidemic and pandemic diseases for my entire career. And I have to tell you that I am as worried about our children today as I have ever been. This virus, the Delta variant of COVID, is every infectious disease specialist and epidemiologist's worst nightmare. I don't think as Americans in our lifetimes we have ever seen an organism that possesses the dual characteristics of the contagiousness that this virus has, together with the virulence, its ability to produce disease. As the governor mentioned, there was a myth that circulated during the first year of the epidemic that children somehow were immune. I think there were people who said children don't get the disease, they can't transmit the disease. We know that those were fallacies all along, but particularly now that the Delta variant has emerged, it has become very clear that children are being heavily impacted by this organism and by this pandemic at this point, perhaps more than ever before. Hospitals across the state are being inundated with seriously ill COVID patients, as you have heard, and the children's hospitals are no exceptions. When a child is seriously ill or has a complex medical condition, there are only a handful of places they can go to get the treatment that they need to survive in some cases. And those places are the designated children's hospitals that have the requisite specialists and the equipment and the expertise to manage those conditions. At this point in time, to the best of my knowledge, every children's facility in the state is absolutely full. I know that at Children's Hospital New Orleans, we have not had an empty bed in any of our intensive care units for weeks. We have avoided going on some kind of diversion or drive-by status because of the responsibility we feel to take care of every child who needs us. But COVID has put a very serious strain on our ability to do that. We have had a census as high as 20 patients admitted on any given day with COVID. That doesn't sound like a lot of patients, but to put it a little bit in context, throughout the entirety of the pandemic, back to its very beginning, the greatest number of patients ever in hospital on any given day prior to this time was 7. So we're at 2.5 times that total today. And we've had 4 and 5 and 6 patients at a time in our pediatric intensive care unit. And those patients require incredible intensity of care from the nurses and the pharmacists and the social workers and the doctors. And so there's a tremendous amount of work involved in taking care of the sickest of the children with COVID. There was also a myth that children, if they did get ill at all, would only get ill if they had some kind of underlying or predisposing condition. But half of the children that we're seeing today were perfectly healthy children who have been infected with COVID and then required admission to the hospital or to the intensive care unit. We test for COVID in a drive-by program at the hospital as well as through our emergency department and outpatient clinics, and the positivity rate on those tests is currently between 15% to 20% on a daily basis. So we know that the children that we're seeing in the hospital are just the tip of the iceberg. As the governor mentioned, there are many others that are out in the community with milder symptoms, and they are potentially spreading the infection to their playmates or to their cousins or to their parents or grandparents.